Hi, everyone. Welcome back to What Happens in Vegas podcast. I'm your host, Dr. Stephanie Canestraro. Today, we have an amazing guest, Peter McLaughlin. He is a hypnotherapist. He cured himself from leukemia in 2003, which I think made you change your path and get into this hypnotherapy and healing people from their subconscious and really just helping people reconnect with who they are. And even before we popped on here, we were talking about how important that is for healing. So thank you so much for being here. I really appreciate it.
Oh, I'm thrilled to be here. Thanks for the invitation.
Yeah. So where do we start? Did everything start? What was your life like before your leukemia diagnosis in 2003? Because I know I have a before story. So
Yeah.
what kind of happened? Take us through that.
The reason I just immediately start laughing is because of the contrast between now and then, and
Mm-hmm.
how I wish that, myself now could go back and tell him, look, just get him into a nice dark room and just say, you need to relax. You need to calm
Mm-hmm.
down. I was working on Wall Street 4 days a week. I was trying to build a business in Westchester County, north of New York City, the other
Mm-hmm.
day of the week. We had 3 small children. We had a 100-year-old house that I was trying to simultaneously restore. We hadn't
Wow.
been married that long. I had a 2-hour commute each way on those 4 days. It was lunacy. And then 9/11 happened
Oh,
right in
wow.
the middle of it all. And as I
Mm-hmm.
said, I was working a block and a half away from the World Trade Center.
Uh-huh.
And my office window was coated with this ash that when it rained, it turned into like a concrete. And there was a cloud over the ground zero, over the pile for months. There were
Wow.
more first responders and military down there than normal people, just workers rather.
Mm-hmm.
And it was just an insane. And so
Mm-hmm.
that I was diagnosed coming out of all that when I was volunteering to be a firefighter EMT in the town that we had moved to from New York into Connecticut. And I really
Mm-hmm.
think that move from New York to Connecticut was the beginning of the awakening, if you will. And the
Mm-hmm.
diagnosis was really the catalyst.
Mm-hmm. Mm-hmm. So when you got that diagnosis, did you tie it together to all of the stress you've been through and all that, or did that come after, or do you even now connect it to those things?
I totally connect it now. I
Mm-hmm.
totally
Mm-hmm.
connect it now. And on a higher level, I would connect it with I wasn't on what I would term my soul's path. I
Mm-hmm.
was I was going down an unconscious road. I was just putting one foot in front of the other. And I
Mm-hmm.
wasn't really doing, I don't think, what I came here to do. So at the time, did I tie it? Not really. It took me a while. I'd say it was about 3 years from diagnosis until things began to really start to click. And it
Mm.
wasn't like I was just unconscious for those 3 years. I was seeking. It was,
Yeah.
after the initial diagnosis, which was shock,
Mm-hmm.
and then it turned to anger, and then it started to turn towards, right, I'm going to have to figure this out because I know the
Mm-hmm.
allopaths are not going to do it. They told me, they said, we don't know what causes this and we don't know how to cure it.
Mm.
That was almost like my liberation moment
Mm.
from a
Exactly. They
paradigm.
freed you from their
Yep.
paradigm. Yeah. So what did you do? How did you heal yourself? What was your path?
Well, I think that I did become a firefighter EMT.
Mm-hmm.
And there was something about that that really helped me to stay focused and to put things in perspective because I
Mm-hmm.
was dealing with people who were in trauma all the time, including fatalities and
Mm-hmm.
fatalities of young, healthy people. Then I did a Panchakarma weekend with an Ayurvedic doctor who was also an allopathic doctor. I did a Qigong weekend. I was reading a lot of books. I was doing a lot of studying. And at one moment, everything kind of crystallized and came together. And it was, oh, I have to learn how to control my subconscious mind in order to control my body. And I feel like that was really the biggest shift was when I went to Santa Fe, New Mexico to be trained as a hypnotherapist. And we had to choose one of the instructors to be our therapist. And the work that happened there really was all about detoxifying my emotional life,
Yeah.
the emotional traumas that had happened in my life. And when I
Mm-hmm.
came back from that experience, everything in my life wasn't going through the prism of chronic lymphocytic leukemia anymore. It was like that was somewhere in the rearview mirror. It was there, but it never was this, my God, I'm going to die. I've got to figure this out. Every moment had to be about that. It was somewhere in the background at that point. And I feel like it was It was the healing the emotional issues, I'll call them traumas of my past, that
Mhm,
led me into wanting to help other people with the same thing, and
mhm,
really believing that, like a naturopath would say, it's emotional and excuse me, it's not just physiological, it's not just environmental toxins, it's also
mhm.
emotional toxins, and I
Mhm.
decided I wanna work on that part of it with people. I wanna help them free themselves from that.
Yeah, so we work more on like those physical ones that are in there, and we need someone like you to complement to bring it all together because that's the whole picture. That's what I needed to heal, right? I don't think the state I was in, I think it is possible to heal just from the emotions and get your body back on track, but I just think when it was so acute and turned on, I needed an intervention, right? Like more than myself, but I don't think it would have been impossible to just use myself. I just couldn't reach it at that time. And we kind of talked about how with all the toxicity I had and the infections I had and the way that they turned on, how it kind of disconnected me from that divine. So I needed something more on this physical realm to
Mhm.
kind of pull me out of it. And now is where you do the deeper healing and the healing where I'm like, no, none of this is turning on in my body ever again. This is
Yep.
that's that, right? So yeah, I think it's so powerful. And part of my acute when I was going through acute issues was I told you my friend was trained in hypnotherapy, and
Yep.
those were the things that got me out of those moments where I felt very unsafe in my body too. So I could, bring myself back to safety where maybe some of the symptoms that were maybe magnified because I was in a state of severe fight or flight because you feel a scary symptom. For me, it was these severe heart palpitations, right? And then I felt my blood pressure going up, and then you get more palpitations the more you get stressed about it, right? So you can interrupt that and you can help calm that down so you don't go down the pathway where your body's just more inflammatory, more problematic. And then, for her, it went a lot of these things that you don't think would come up. For me, it was like I was going back into like I don't know, like weird kindergarten, like small things that were like
Mhm.
apparently traumatic for me. So can you talk about like because I think all traumas are relative and you being like a firefighter is one where you're seeing these intense traumas. And then like what other things come up for people that are traumatic in lifetimes that kind of surprise you sometimes?
Well, I don't know that I'm surprised anymore because I've been
Yeah.
doing this for 20 years. But what may surprise other people is being called up to the head of the
Yeah.
class when you're in the third grade and
Mhm.
asked to solve a math problem and you can't solve it and all the kids are laughing at you and the teacher's just sitting there doing nothing. And then that person develops anxiety
Mhm.
around speaking in public or meeting
Mhm.
new people. It's such a prosaic event that it
Mhm.
wouldn't necessarily have the same impact on everyone, but for this
Exactly.
person, it really was devastating. And if you think about the mind of a child and where they are, it all makes sense to me.
Mhm.
Or the infant who was crying for their mother in the crib, and the mother was maybe taking a nap or didn't hear them and didn't come. And so the mind, the subconscious mind, makes up this belief that they are unworthy of help or
Mhm.
that help isn't available for them, that they have to do it all themselves. It's
Mhm.
things like that that I think would surprise a lot of people. It did when it first came up for me. Rather
Yeah,
than the
those
big events, those are there too, for
those are
sure. And I work on those with people all the time. But sometimes it's something much, much smaller that you would never have been able to recognize.
Mhm. Yeah, that's what I noticed. So that will resonate for a lot of people because I know I have some people, they're like, "Well, I don't think I really had any trauma at all." And I was like,
Mhm.
yeah, like those are the ones where you're like, okay, maybe there you have to dig a little bit deeper because we all have trauma and it is all relative. And there are the ones that make more sense and get more attention. Something that stands out for me recently was, when I was in this acute state and I have a lot of knowledge about the body and I knew something was really wrong with me. And I went to an emergency room and I was told to go home and I was perfectly healthy. And I remember being like, I'm here at 4 in the morning. Even when I look at my own blood work, my white blood cells are severely elevated, right? So if they're supposed to be between 5 and 8 and mine are 16, that to me is screaming a problem. My heart rate changed from when I got there. It was at like 200 over 100 my blood pressure. I had 120 beats per minute at rest. I was having 70% of the time PVCs, and yet I'm told I'm healthy and I was having some stress. And I said, "Well, I'm not I don't wake up in the middle of the night with this happening, it's stress. I don't have any stress on my mind. Oh, don't have as much chocolate and coffee. And I remember thinking, like, I'm not letting them get to me because, like, I know better about the human body than them. And I just was going there to make sure I wasn't dying because I've never had these symptoms in my chest. But like these people that go for help and they get shunned or, the medical gaslit, like I feel like that is also a huge part of this chronic disease era where people don't understand it and everything we were talking about before coming on about COVID and what it does to your body, you know? So, I mean, you must be seeing tons of that now. Like, have you seen a shift since post COVID in what comes up for people or even how much volume?
The biggest shift I've seen post-COVID is people being more open to things
Mhm.
that they might have rejected previously. I saw a study not long ago that indicated that trust in allopathic physicians went from 70%
Mhm.
pre-COVID to 40%.
Yeah, it's a
And
huge shift.
people that come to me tend to come to me. If it isn't a referral, they tend to come to me when they've exhausted everything else.
Yeah.
Because what I do is so far out there in
Mhm.
terms of what people normally think of when they think of, "Oh, I've got this issue and I wanna heal it."
Mhm.
And the best clients are actually the people who have the most open minds, and
Mhm.
the open mind is often created by exhausting these other avenues and being
Mhm.
told things like you were, like, "Oh,
Mhm.
you're totally healthy, stop eating chocolate." Like, "What are you talking about?"
I know, and I'm like, "But I'm not even eating chocolate." I'm like, "What, 1 square of chocolate? Like, that's what's doing this? Like, this is crazy." And I mean, it mimicked what happened to me in 2010 when I literally got bit by a vector, literally wasn't tested properly, and had textbook Lyme neuroborreliosis, and still didn't even figure that out until this all turned back on in 2022, right? This reactivation. I think, I wasn't taken seriously then until half my face went paralyzed, right? Bell's palsy. Okay, now I'll take you seriously. I had been to the ER multiple times thinking I was having a stroke, thinking I was having that, like,
Wow.
because my nervous system was so attacked. And if you read Lyme neuroborreliosis, I was literally what you learn in a textbook, and like just like thrown away, overlooked, and only because I had to keep pushing did I start to get some even investigation. They never found out what was actually wrong. That was all me, but anyways, it's crazy. And I mean, I think there's a huge time and a place for allopathic medicine. I wish we had more access sometimes to their testing and there are things that they can do that in these trauma situations. But I think when it comes to your everyday health, I think it's the wrong person to go to 100%.
I
And
completely
for,
agree with you.
yeah.
When I was an EMT, I felt great about taking somebody to the hospital if they had just cut off their fingers or they fell out of
Yeah.
a tree or they were in a car accident. I didn't feel
Hmm.
so good about taking them to the hospital when they had a chronic issue, a medical issue.
Hmm.
And my understanding of that, after thinking about it for a long time, is that allopathy, first of all, is organized around the alleviation of symptoms. That's what their
Hmm.
philosophical underpinning is. It's not
Hmm.
cure, it's alleviation of symptoms.
Hmm.
And secondly, if they can see the problem, the
Hmm.
broken bone, the
Hmm.
fingers that are not attached to the hand anymore, they're really good at fixing it. If they
Hmm.
can't see the actual problem,
Hmm.
they have problems because
Hmm.
they look at cancer and say, the tumor's a problem. The tumor's a manifestation of a problem.
Hmm. I know. I know. Yeah, and they just cut it out. They're like more mechanics to the body. They're
Yes,
like, "I'll cut it
exactly.
out, I'll
Yeah.
poison that, and that's that." Like, and then we like just hope for the best, even though like part of our treatment is so toxic that we know it can cause multiple other problems. So that's where, people are starting to doubt and look for different answers. So I know a big thing right now, people are using like, GLP-1s and peptides, and I love peptides. I think they're great. But you do a lot of weight loss stuff using people's mind and hypnotherapy. So how did that end up being a big niche of yours? And what is it we're just removing blocks that help us care for ourselves more or get more in line with ourselves so that we take care of ourselves better? Is that what's happening?
It's a great question, and there's a multifaceted answer. I'll start with the easy ones, which is hypnosis traditionally has been known for smoking cessation and weight loss.
Hmm.
So when people are searching for those to solve those problems, they're looking at hypnosis. And my YouTube channel took off a few years ago. It has 130,000 subscribers. There's like 300 pieces of content. And the and I create content around all kinds of issues. But weight loss is the one that really went crazy. And I
Mhm.
have a video I've got 3 videos that have over 1,000,000 views each. One of them has 3.6 million views. And if
Wow.
you read through the comments, thousands of comments, people that I've never met, never will meet, talk about losing all of this weight. Even their husband lost weight that didn't even know what they were doing just by pressing play and then going to sleep at night.
Wow.
And that's a subliminal track, subaudible. So all they hear is the sound of rain or something. And underneath the rain, what's masking that are the actual words.
Wow.
And then I have people that I work with one-on-one. So
Mhm.
as we come down this level of complexity, the subliminal ones are built around because they have to be generic. It can't be just for you. It has to be for a wide
Yeah.
audience.
Yeah.
It's built around deep relaxation,
Mhm.
sleeping well because poor sleep is associated with weight gain. It's
Mhm.
built around suggestions that you will feel completely satisfied with
Mhm.
2/3 of the food that you used to eat. It's
Mhm.
built around adequate hydration. It's built around feeling good just moving your body. It's not telling people to go sweat it out in the gym or anything. And then there's also emotional pieces in there, like your new identity is an identity as a healthy person. It's also, I put on every one of the tracks, you are safe to release the old weight. And why that I think that phrase is important is because the conscious mind hears that and says, "Oh, I can let go of those last 15 pounds." But the subconscious hears that and could say, "It's okay to let go of the emotional weight." Because I think emotional weight and physical weight are correlated. Not in every single case, but they're often correlated through emotional eating and stress eating. And so these
Mhm.
tracks are built around all of that.
Mhm.
When I work with a
Amazing.
person one-on-one, I'm able to figure out for that person what specifically is driving the weight gain.
Yeah, that's amazing. Yeah, everyone should listen to that video. I listened to some of your videos and you do have the very soothing, like they're great. And like your
Thank you.
voice in the, yeah, like very, very, I will be diving into more of them for sure. So who is your favorite type of client to work with?
The first thing I would say is an open mind.
Yeah.
A person who is a seeker,
Yeah.
which is what I became after I was diagnosed with leukemia and Lyme disease on the same day. There was
Yeah.
also the second diagnosis.
Because I was gonna say with all CLL, it's chronic infection, and it's, like, crazy to me that it's even called really a cancer because it's like your body is responding in a way it should, it's just not clearing what it's trying to clear, you know? And we've seen that firsthand with patients because we go after all those stealth infections, and one of my close family members is one of them where
Mhm.
yeah. So it's really, really interesting, and then the body loses control eventually because it's just overstimulated from my physical side. And then the emotional side, I mean, when I think of this close family member and I'm like, definitely going to connect them with you after this to
Oh,
get
yeah,
clean up the final bits.
sure, sure.
Yeah. But okay. So you did neuro linguistic programming too.
Yeah.
I've learned about that before, but I can't, is it like the way you talk to yourself? Is it, what's the
So
basis of,
NLP is a perfect match with hypnosis and hypnotherapy. They go together really beautifully.
Mhm.
There are certain concepts in there. I mean, NLP will say it's the study of human excellence, which doesn't tell you a lot.
No,
But
I'm like, what?
ultimately, what that really means is that the founders did a lot of modeling. What works for this person or for these people could be transferred over here. And there are certain concepts, like in hypnosis, you could take a person, say an elite athlete. You said you work with a lot of elite
Hmm.
athletes. I have worked with elite athletes as well. You
Hmm.
can take an elite athlete to playing their sport in a flow state when they're at a peak of performance, and while they're in that state you could help them extract exactly what's happening
Hmm.
with their posture. Where is their mind? What did they eat last night? you know, as far as the mind goes, what kinds of thoughts are going through their mind in these moments? How do they
Hmm.
feel? Where's the focus of their attention? Is it in their head? Is it in their heart? Is it in their limbs? And
Hmm.
you can then, using hypnosis, bring them to that state over and over again. You can associate a color with it because that's part of NLP is something called anchoring. When you hear a song and you get a certain feeling that comes over you, that just means that that song has been anchored or attached emotionally
Hmm.
to that feeling state. And you can create and reproduce this. So there are all of these different aspects of NLP that I marry to and use with hypnosis all the time.
That resonates a lot. I was just like thinking because we work with a lot of NHL players and they're in the playoffs
Mhm.
right now. And there was one team
Now
where,
Buffalo just got knocked out.
but there was the one team that just played last night and they had 2 weeks off and they were on fire before. They just kicked 4 games. They kicked out one team. They hadn't lost a game yet. And you saw like they lost that. Probably that they need someone like you to bring them back into that flow
Yeah,
state that they were in before.
yeah,
They're just a
yeah.
little we'll see if they get it back. But I was thinking about that because I'm like, I wonder if they just kept playing, they would have had that momentum that they could still build off of. But
You know, years ago, I had proposed to the Buffalo Bills, the football team, that they should be playing subliminal slash sub-audible tracks in the
mm,
locker room and in the weight room, any parts of the facility that should always be going
mhm,
constantly, and
mhm,
that they should have clips visually playing
mhm,
of, like the greatest hits kind of thing, and then have sub-visual messaging
mm,
that's going on behind that all the
mm,
time,
yeah,
100% of the time. And they should be preparing their players who get injured and are gonna undergo surgery. They should prepare them for surgery with hypnosis and then give them hypnosis tracks for recovery, because the literature and my personal experience is you recover 20% faster.
mm,
What does that mean to a team that is paying somebody, $5 million a year? What does it mean to their success if they can get them back even 2 games sooner than would otherwise have been possible?
mhm. It means a lot though. And I mean, I've worked with a lot of teams and they're not always the most open. They're
No,
more
the
I mean, I
players
feel
are.
like they're starting to be. Oh yeah, no, the players are. I just mean their governing bodies
Yep,
that yeah, make
that's
the
right.
decisions. But I have seen changes in that too, actually being, ever since COVID as well, because we were talking before about how the way that was dealt with maybe changed a lot of the faith that people had in our system. And I mean, if you look back on the history of medicine, like it used to involve way more natural things and shaman
Yes.
healers, right? And there was a big turn when there was specific family, the Rockefellers,
Oh, uh-huh. Yep,
right? And they started the pharmaceuticals and they wanted to use all this petroleum like
yep.
that they had left. And that's how we got, and then they just had all the money. So they could just, once you have the money, you have the power, right? So I
Mhm,
think the power still lies in us though. And I think it always has. It lies in the majority. So if we can
mhm.
shift, then they have to start looking into these things and shift along with us. If you're on the cusp, there's always that third of people on the cusp, like this is
Oh,
maybe
yeah.
resonates with you and we can start to get more positive changes because, I think our body's really powerful and I think you help bring that out and show that even like and showing the power of the subconscious. So, when the subconscious messaging is fear all the time, and then what does that do to your body, right? Like, do we get sicker? Of course, we get sicker. And, but then,
Well, it's truly remarkable. I mean, one of the first mental breakthroughs I had regarding weight loss was the understanding of physiologically what's happening to people when they move into a stress response. And let's
mhm,
keep in mind, for people that aren't necessarily versed in this, your autonomic, that just means automatic nervous system, only has 2 modes. That's it.
mhm,
Fight or flight, rest or digest. That's it. You don't have any other choice. If you're not
mhm,
in one, you're by definition in the other. When you're in a stress response, you're dumping adrenaline and cortisol into your bloodstream. And
mhm,
part of what cortisol does is tell your body, hold on to all available fat, especially in your gut. And it's an evolutionary system that probably means it's why you and I are here today, because our
mhm,
ancestors made it through a difficult winter. They made it through a crop failure. They
mhm,
made it through the main breadwinner dying because they went
mhm,
into a stress response, dumped that
mhm,
cortisol. It told their body to hold on to all available fat.
mhm.
So stress, there's a reason why stress kills people. It
Yeah.
diminishes your immune system, your reproductive system, your endocrine system, your digestive system. And I don't think we really we really get that on the ground level. We don't
Mhm.
really understand that. We don't
Mhm.
understand that sham knee surgery is just as effective as the real thing.
Yeah, the placebo effect is something that I always talk about to try to get a point across to people. And I'm like, you do realize that even the whole medical system and pharmaceutical field has to prove that their thing works better than your own mind healing you, which is that 30%. So if someone could just teach us to harness that 30%, which is, I think, what you're doing and what we try to tell people and empower people too, like, because again, supplements helped me. Things that grab and detox me really, 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 really helped me in those times of need. Do I think my body could have done it itself if I was in the mode where I could connect to it? Yes, 100%. And I think I've seen people who have done that. And I think the more power that we give to that, the better off we'll all be. But I think that what they're doing, and we talked about before, was there was a presentation by, you were talking about Rudolf Steiner and how, he said we'd be disconnected from the divine and that puts you into a stress state. And I told you I felt that when I had all these infections
Yeah.
and heavy metals. So I think I needed something to pull those things out so I could even just get that inkling of a
Mhm.
connection so that I could elevate to the healing resonance and frequency. And I don't know if you who know frequencies, because look at subliminal messaging. When they come out with a new frequency that our body doesn't recognize that's known to be toxic, like, how do we all counterbalance that? So I talk about that a lot, but do you talk about frequencies a lot with like, I mean, you're using sound frequencies. Your
Yeah.
voice is a frequency that's healing. Like, yeah. So,
It is, and I dabble in frequencies on my tracks.
mhm,
So I the first thing that I learned was that all music used to be tuned to 432 hertz
mhm,
prior to World War II. All music
mhm,
was 432 hertz, which is known as a whole tone, which is also known as a healing sound.
mhm,
And if you look on the internet, you will find descriptions. I've never been able to verify it, but that suddenly, without really knowing why, the world decided to change to 440 hertz, which is discordant. It
mhm,
creates a kind of um, uneasiness within
mhm,
people. And
mhm,
I have a niece, and she's married to a guy, and they're both professional musicians. And I remember asking them, I said, was music previously tuned to 432 hertz? And they said, yes. Was it
mhm,
changed in the 40s or 50s to 440? Yes.
mhm,
So when
mhm,
I create a track and there's music on the track, I retune it from 440 to 432
mhm,
for that
mhm.
reason.
Yeah. And
You know, I also
there,
use I
sorry,
also use
go on.
binaural tones. So
Yeah. Yeah.
you have to use earbuds or headphones for that to work.
Uh-huh.
But there's a slightly different tone going in your left ear than is going in your right. And your brain creates a third one, which
Mhm.
entrains you to that frequency and helps you go into a deeper state of relaxation. So I've also used those as well.
Yeah, I love binaural beats. I forget what I was just gonna say, but the sound, I was talking about this. There's this guy who had severe Lyme, and he's a musician, and he created a whole line of music that is tuned to the
Um,
old frequencies. His name's Saint Finnegan, and his music is beautiful, and even his, like, the words, when they have words, it's, like, all about being grateful, and he came out of, like, severe Lyme and everything, so that's one person that I can think of, but, yeah, like, sound was really helpful for me. And then even frequencies, I have a watch that I wear that gives off frequencies into the vessels, because different frequencies, bugs don't like. So Lyme doesn't like certain frequencies, and you can
uh-huh.
help eradicate it with that. And parasites don't like certain frequencies. So that's the whole
Yep.
Rife machine frequencies and
And
all
Hulda
those
Clark
Rife.
too.
Yeah, and they would, confiscate those machines from people, right? Like,
Right. I
it's
think there's a
crazy.
reason that they're trying to block out the sun, and I think it has nothing to do with climate change. I think that
Of
that's a
course not.
scam personally, and I think they want us out of the sun because the sun. I remember I was talking to. We live in Florida,
Mhm,
and you have to do some exterminating here, like preventive exterminating, which I
mhm,
hate doing, but you got to do it here, or else it's going to be worse. And I talked to the exterminator, and he was talking about how the sun deactivates the insecticide that they put down. I'm like, wow. And they want us where? Out of the sun because
exactly.
it destroys the poison.
I know.
Plus,
It's
it gives you vitamin D and
mhm.
it energizes your cells. It's the basis of all life.
I
And
know,
they
I
want to
know.
block it? What does that tell us? It's like the
Blocking
new
it
Rockefellers, basically.
exactly, and blocking it with heavy metals like liquid chafe if you research what you can because it's all like, they're say I don't know how you can call something a conspiracy theory that you're staring at happen. It's crazy to me and how, like, some places are blocking it or not doing it. So it's, I hate that word, but or that phrase, but, yeah, I mean, it's full of heavy metals and, like, even, like, aluminum and that when it falls down to the earth and then we're swimming, like, it's coming back into the atmosphere. It doesn't just stay up there. So, like, it's blocking the sun and then some, right? It's wild to me. And I was researching a lot about it, and apparently they can't just stop it because of the changes that it's made. They'd have to, like, slowly phase it out or else it would be very bad for anyways, yeah, no, it's definitely not. I also looked into the whole climate change things, and there's been times before all there were so many humans and we weren't eating meat and, like, it was like Paleolithic times, and they can tell by, like, the rings and, like, the caves, the temperature that it got up to, and it's been way hotter than it has been. So, I think that that's another thing where, gosh, the climate change stuff is a whole other
And to
thing.
get back into the frequency and its
Uh-huh.
impact on the autonomic nervous system and the impact of the autonomic nervous system on everything that deals with your health, we have to find some way of balancing awareness of what's happening
Mhm.
with not allowing ourselves to keep going into a fight or flight response.
Exactly. Yeah.
That the way we're all gonna weather the storm that we call life and the people that are doing the things that they're doing is by finding a way to keep our frequency as high as we possibly can. It's
Exactly.
gonna improve our health, it's gonna improve our relationships, it's gonna improve whatever work that we're bringing to this world and hence our
Mhm.
finances. We have
Mhm.
to find some way of not allowing ourselves to be drawn down into this dark, low frequency place because everything we
Exactly.
don't want is vibrating at a low frequency.
Yeah.
Illness, bad music, like everything that is unhealthy is vibrating at a low, low frequency.
Mhm.
Arguing with your spouse, all of it.
Yeah, yeah. And I
Depression.
try yeah, and I try and talk to my patients about that too because I talk so easily about this because I don't feel fear. It's not turning on a response for me anymore. I'm not mad. I realize, like, we can do what we do and work with what we have, but I think I was so sick, and even though all of these things are still happening, I've still been able to elevate and feel better and better
Mhm.
and then in some ways better than I did before and in some ways still need some work. But to me, and I share my story with my patients. To me, I know what the body is capable of given the right tools, which include the frequencies and the subliminal messaging and the things that help us take the bad stuff out temporarily and reconnecting with the earth and nature and all those things that help our autonomic system switch into that rest and digest side are so powerful. So it's like I talk about them to bring awareness, but just like you said, not to bring fear because again, that just throws you into more potential for sickness and lowers your vibration and gives you more chance of being sick, right? And even
Yes.
even when
Yeah,
it
and
all turned go ahead.
I'd like your listeners to understand this, which is your subconscious mind has no concept of time.
Mhm.
Everything is now. Something that happened to you 30 years ago, to your subconscious mind, if that thing hasn't been healed in your subconscious mind, it's happening now. And
Mhm.
when you get quote unquote triggered, it's just
Mhm.
activating something that your subconscious views as a clear and present danger. And that's why your heart starts beating rapidly. That's
Mhm.
why you fly into a rage or get angry. That's why
Mhm.
you wake up and you're in a state of fear
Mhm.
because your subconscious, its role is to protect you. And if it still thinks that that thing that happened to you 10 years ago or 30 years ago is a clear and present danger, it will cause your body to behave as if that's happening again.
Mhm.
And the only way to solve that is to heal that event within your subconscious so that when it gets triggered, it doesn't put you into a fight or flight response.
Mhm.
And you have 60,000 thoughts a day,
Wow.
and you're aware of 5% of them. So, what's going on in that software programming that
Mhm.
is actually running your life?
Is that how you know you're healed from it when it doesn't trigger you anymore?
Yes, yes,
Okay.
exactly right.
Mhm.
Exactly. Before I went out to Santa Fe, New Mexico to study this work, I had an anger problem.
Mhm.
my kids were little at the time, and they did little kid things, and I would feel my jaws clenching, I would feel my fists tightening, I could feel my whole body like it's preparing to fight or something, and I'm dealing with a little kid who's just doing the little kid things.
Mhm, mhm,
When I came back from there, that was gone. They were still little kids, they were still doing those things, but it wasn't
mhm,
sending me into that place. I could
mhm,
look at it rationally and say, "I can't allow this to continue. I have to stop this." But it wasn't like my body was being hijacked anymore. So, yes,
mhm.
that is exactly how you know it's been healed.
I think that's important because even here, I'm like, okay, people that do talk therapy, but then they're talking about it and it's making them mad again. Like, is that like, does that even help to clear it? Like, I don't know
So
if that's
so
helpful.
you'll appreciate this, I guess. When I was trained as an EMT, we had 2 steps, basically. One was rapid assessment.
Hmm.
Figure out what's going on. You don't just start working on somebody until you figure out everything that's going on, because there could be
Hmm.
something worse sticking out of their back and you're working on their
Hmm.
front.
Yeah.
And the second step was do something about it. I feel
Hmm.
like talk therapy is step 1
Yeah. Yeah. Yeah.
that
Like, what are you
doesn't
doing about it?
really get to step 2.
Yeah.
And you
Can
gotta
you
do
Can you do it yourself, like, where you just, like, bring yourself back to a moment, or do you need to add in that frequency or that thing that makes you tone that you were, anchor? You talked about an anchor, like, are there different
you
ways?
can do
Mhm,
certain things yourself. So, for example, you've probably heard of EMDR, this rapid eye movement that
mhm,
I think is actually quite effective. So, for
mhm,
people that are thinking about doing talk therapy, if your talk therapist does EMDR, I think you're going to have way more success than if you
mhm,
just talk about it.
mhm,
And there's something called havening, Havening, that's very similar to EMDR, which
mhm,
you can actually do yourself. I do it
mm,
on myself. And you basically take your mind to the traumatic incident. And I'm not telling people they should do this or not do this, do
no,
your own research.
mhm,
And there's several ways of doing it, but you're basically tapping, like tapping your thighs and blinking your eyes as fast as you can as you reprocess this event. And
mhm,
your subconscious mind will actually reprocess it for you. For some people, it dims it or it moves it farther away as they go through different iterations of this. For other people, it actually changes what actually happened. So maybe the person is speaking up in a way that they weren't speaking up before.
mhm,
Maybe their current adult self comes back in time to rescue their younger self. So
mhm,
there are things that you can do for yourself that go
mhm,
beyond listening to some of those tracks, which you can certainly do for yourself to put yourself into a rest and digest state or to
mhm,
resolve a weight issue or whatever it is. Yes,
mhm.
there are empowering tools that we can all use.
Yeah, it's interesting that EMDR has to do with eyes, just like, you know, so much vagal nerve calming has to do with like there's so much power in
Mhm,
like the eyes and anything that you could do to affect the facial nerve and that's why even in our world of bioregulatory medicine, any like infection that's above the collar and close to the head and the brain has so much impact on the rest of our body
mhm,
because, even if things can cross our blood-brain barrier, they're changing our frequency there and they're causing inflammation there where a lot of the information is given to the rest of the body or connected to higher, right? So,
mhm, mhm,
yeah, that resonates as well because I know with the eyes and even treating around the eyes because we do manual stuff, it is very relaxing for the rest of the body. So,
yep,
it just I'm just tying those things together because it makes sense to me. But this is all really powerful stuff. So, I mean, you have your website, but you also have your YouTube channel where you have a lot of these videos that people can check out. But are you still taking people one on
mhm.
one?
Yep, I am. I am, and I
Amazing.
about 70% of my clients are remote,
Hmm.
30% I see in person. So I can do either or.
Hmm. That's amazing. That's so
Mhm,
helpful for people.
yep.
Yeah, and then you you like people who are open, but there's no, like, really specific niche that you love diving into more. You just
I actually I love relationship stuff. So I
mm,
think our problems kind of fall into 3 buckets. There are 3 main areas of our lives. One, I
mhm,
would say, would be your emotional and your physical health. The
mhm,
other one is about your work,
mhm,
which includes money and your purpose. And then the
mhm,
third one is relationship. And in relationship, usually the biggest, most important one is your significant other.
mhm,
And that gives you, I would say, the greatest joy,
mhm,
but it also can give you the greatest pain.
mm,
And because of that reason, I think it's the most important of the 3 buckets in a sense. And I love working on that one. And my belief is that the health of the relationship has way more to do with the individuals than it
Mhm.
does with their dynamic together. I think the dynamic together, for me, it's like 20%. It's not nothing, it's something, it's important,
Mhm.
but it's more important for the individuals to clean up what they brought into this relationship
Yeah.
in the first place. So I really like working on that. I mean, I like other things too, but that one is the most
Mhm.
challenging and the most rewarding when you're able to help somebody kind of solve that.
It's interesting you say that, and I don't think I mean, we think about it and a lot of people do, but I think it's kind of overlooked because you do see those people that it's hard to help them get better from our perspective when they're gaslit by their own partner or their own partner isn't buying into what they're doing. And then
Yeah.
when we see that they don't have that support, it's so
Mhm.
hard for them to get better.
Yes.
It's like one of their biggest barriers to recovery. So you bringing that up is another moment for me where I'm like, wow, like, they both have to see you in conjunction with what they're doing with us, like that
Yeah, and
kind
at a
of thing.
minimum, the one partner who is on a healing path, it would be valuable for them to understand, "Why am I with this person? Out of all the fish in the sea,
Mhm.
I chose this one."
Mhm.
And that's not to blame anyone for anything, it's
No.
because 'cause we're all making unconscious decisions all the time, that's how we roll as humans.
Mhm.
But it would be nice to know, even if the relationship wasn't working out, why did I choose this person? So that I
Yeah.
don't do it again. So I don't just
Mhm.
wake up one morning and realize I'm with the same person with a different face and a different name.
Yeah, exactly. Exactly. That's an important one. I think people are gonna be running to you for that one. I can think of a few friends too that are just doing the same pattern over and over and over again, and I did it in the past too. I didn't find my proper partner until later in life, and, he was the one helping me through illness, not gaslighting me, right? So,
Mm,
I think it's really important because in those dark times and, like, that's who you lean on. That's who's
yeah,
there. So
yeah.
I think it's
The other
really,
the
really
other thing I
important.
would say is with athletes, what I love about them is they're the ones I've worked with, super open-minded. They're looking for a way of gaining an edge, and if they feel like they
Mhm,
can gain an edge, because it means everything, even if it's only a couple percentage points at that level,
mhm,
that makes
yeah,
all the difference.
mhm,
And then they follow through.
mhm,
So when you say, "I want you to listen to this track for the next," they'll do it, just no question. Or if
mhm,
you say, I think this issue is related to that issue and we need to clean it up," great, let's go and do it. I
mhm,
love that spirit of, if they get knocked down, they're gonna get back up.
mhm,
If it requires effort, they're gonna put the effort forward. They just need some direction.
yeah,
So I love working with athletes. My daughter's a professional athlete. My dad
yeah,
was a professional athlete. Like
mhm,
it's kind of in the blood.
mhm,
And what I have found is that, and I guess it should be predictable, that even things that happen to them in their personal lives when they were children are playing out on the field or on the ice or on the court.
mhm, mhm.
And by clearing those things up, it's going to help them in their profession.
Yeah, that's very important, and that will resonate too. Because there's one thing I know well, like, since the day I graduated, I've worked with athletes as, like, a main portion of my practice, and even though it's changed and sometimes we work with them in different ways now, it's still always been very fulfilling, because again, they, see change, they feel small changes, they adapt and go after it. Yeah, the ones that end up working with us. And then there's the ones that just aren't there yet and you meet them. I meet them in different ways because I have the physical component, like the manual practice, because I'm a chiropractor by trade and we do acupuncture, we do soft tissue, we do all of this like really specialized soft tissue techniques. And they all are ready for that. And then you start seeing them change and be ready for other things.
Yeah,
So yeah, yeah, yeah. We all have a time and a place in our journey where
we
we're
do.
searching more. Yeah.
We do. I have a question for
Mhm.
you as a
Mhm.
chiropractor. Do you use or are you aware of kinesiology, like muscle testing?
Yeah, yeah. So I became aware of kinesiology not until I got sick, which was, well, actually, no, it was early on because I got sick in 2010. So one of the first things that got me interested in functional medicine was it was actually a personal trainer who was doing applied kinesiology and he tested me and said, you have like no stomach acid and you have to take these probiotics. And this was in 2010 and it was a sachet and he's like, there are little bugs in there. I'm like, little bugs. Like, I mean, how little we knew. I even just finished chiropractic college. And like it made such a change to my health. And it was part of, and like he told you, he was like the more low carb at this time. So he's like, don't eat bread and stuff. And I'm Italian. And then it turned out I had celiac disease. So he brought me on this path. And then I remember I drove 4 hours to see this applied kinesiologist. And, and it's all looking back because he tested me and he's like, you need lithium orotate though, right? People think of lithium, the drug. And I'm like, oh, this crazy guy's trying to put me on lithium. It's when I knew nothing. Lithium orotate helped me so much when I had all the Lyme because it calms down your brain and your nervous system and it gets depleted by COVID. So like, it's such a game changer. And it's just crazy how it like came back around. And then I did formal training with ART with Diedrich Klinghardt, who I was telling you about before this. So I've done ART. I've learned that's his type of testing that he calls it. And then I've done also muscle testing through Cellcore, which is a big supplement company that they developed all of their what works for people based on muscle testing. And this is the interesting part. I was having such great results doing muscle testing. I could even muscle test myself. When I got really sick this time and I felt like I was cut off from the divine, I couldn't get right answers. And it's only starting to come back now.
And
Yeah.
how did you treat yourself, I'm assuming physically, to reestablish your connection to the divine? Was it things like augmented NAC or something?
Augmented NAC I took, but what I was telling you even before we got on, that IV with the gold, silver, platinum, what I now call the precious metals. I mean, I was already, as I lowered my toxic load, getting better, but I still had that melancholy like feeling, right? Like, and that's when I started researching gold and I don't know why gold stood out so much more in that cocktail because I'm like, I love gold and gold's so expensive and gold is like, I don't know. So, but to me, so I dove in more to the gold research. I was already using silver. I used
Mhm.
silver orally, and that was something that helped me so much. Like my esophagus got attacked by Lyme. I had severe ulceration. Like I had like crazy stuff and drinking silver, pH structured silver, like if I didn't have that, I'd still have multiple problems. So when she was putting silver in the IV, I was like, okay, I'm comfortable with that. And then she was like platinum gold. And I'm like, what? Like, I've never heard of these things. Right. And then you dive into, they used to use gold for severe infection and they use it for breast cancer and they use it for this. And like, they talk about these things like, there's like, if you type in silver online, it's like, we'll turn you blue, like, but that's a man that was making silver on his own and you're not supposed to add salt. And he was making silver protonate instead of colloidal silver and especially pH silver that doesn't accumulate inside of you. So I think these precious metals are not getting enough use anymore. And so I found some companies that are doing things with gold and the way that it reactivates your brain. And a lot of them are brain companies. There's one called Ignite. And there's gold weaved in a process that they have into every supplement to make you absorb it better and cross the blood-brain barrier. And so all of my symptoms that were in my spinal cord, I had like meningitis-like symptoms. I would have like a huge divot in my head that's known to be caused by like Bartonella
Wow.
infection when it's crossed the blood-brain barrier. I had
Wow.
extreme pain in my spine shooting into my hands and feet. And those were exacerbated when I took the gold when it was killing everything off. Like the surge of energy I had in my spine was terrifying. I was in Dominican. I was like, what do I go to the hospital and say? I got gold put in my veins. People are going to think I'm crazy,
Yeah.
So, but I knew that what happens when you have a severe fever that won't break, you have too much cytokines. So I started taking binders that bound up the cytokines, the things that were creating this huge herx. Although the hyperthermia or the fever was something that I welcomed because I know that kills Lyme and they
Mhm.
try to put you into that. And I hadn't mounted a fever in probably a decade. So when I did that gold and it turned on my brain, when that fever broke, after I took Pectisol, which is a modified citrus pectin, I tried a bunch of binders before that. They weren't doing anything like humic and fulvic, chlorella, clays. But while I had this fever, this Pectisol, it like immediately I felt, oh my gosh, the pain subsided. So I took more and more of that. The day after that fever broke, I was like 80% back to my normal self.
Wow.
There is nothing else that does that when you're in Lyme and stuff and like that deep into it and it's like, so, I mean, I like want it to be more accessible to people, but even the oral gold that I'm taking is helpful. right? So I think that it's something that needs to start to be talked about, but I think it's so powerful that it's just going to be repressed because, they don't ever want those really powerful cures
No.
getting out there, as sad as that sounds. But yeah, so that's what I found where I started to be able to reconnect with life and wanting to be social again and feeling more like myself. And
Mhm.
yeah, so, it was a mix of things in there that helped me and things that even gave your cells energy, like NAD. Like, it was a cocktail that was strong. This girl really goes after it. And I think that could be bad for some people, but my body was ready enough for it that it cleared stuff out, and it was the biggest change in my health that, I felt like and immediately. So yeah, I just
Mm.
like that was a long answer to that, but really that's what I feel like helped me reconnect.
Oh,
So
that's exciting. That's
yeah.
really, really cool. And there's
Yeah.
a reason why gold has always been so valued
Mhm.
by humanity, and it's not just because it is. Like, there are reasons, there are
No,
other
yeah,
reasons. Same with
exactly,
silver.
exactly.
Same with silver. And that whole concept of born with a silver spoon in his mouth has to do with wealthy parents putting having a child suck on a
Suck on a
silver
spoon.
spoon when they were sick because they knew that little micro particles of it would come off and help kill whatever infection
And
that they
they
were
would
dealing with.
survive. Kids that were dying were the poorer ones that didn't have. Yeah, so they are precious metals. People are, like, on the
Mhm,
internet, even in functional medicine world,
mhm,
going, "Oh, those are heavy metals," and if they tell you, "Well, no, they're noble metals, they're precious metals."
mm,
It's different. It's different how they work in the body, it depends how they're created, but, yeah,
mhm,
that's a whole thing that I've been diving into, and then, again, when we talk about frequencies, it's literally changing the frequency in your body, and so and think about silver blankets or silver, that's what protects you from the electromagnetic stuff, and I'm like,
I just got a beanie from that company called Haven, Havn,
yeah, yeah.
that is lined with the silver threads.
Mhm. And yeah, so think about
Mm,
like and then inside your body, what is it doing? Because we now know that the EMF can because they say it's safe because it only absorbs like 1 to 2 millimeters, but that's where it comes in. Your sweat glands are there, your fascia is there. So then it accesses your whole body. So if we're getting like I think that they missed a whole thing on they're like silver doesn't really do anything as a mineral in the body. I think that they're completely wrong. And, like, the whole diving into minerals and how minerals affect our frequency and minerals, how they're depleted with all the EMF and even COVID and burning through them, like, minerals are a huge, huge part of the practice for us, so, yeah, really, really powerful stuff, and I think when it comes to your stuff, like, pairing those together is the
mhm.
most powerful. So,
That's what I think too. From the beginning, I had the concept of firing on all cylinders.
yeah, yeah,
Yeah.
yeah. Well, amazing. Anything else? Like everyone's going to love this episode, but anything else you want to add? Where can people find you?
I would just add quickly that part of the reason I asked about the muscle testing,
Mhm. Oh, yeah. Sorry.
link it back with what I do in my practice and what people can do on their own.
Mhm,
So, what I use to access the same wisdom,
mhm.
because people will say it's the body's wisdom. What does that mean? Nobody
Yeah.
really knows. Is it the subconscious mind? Is it your soul? Is it your spirit? Is it your higher self? Nobody really knows. But everybody
Mhm,
knows that there's a part of you that has this higher level of wisdom.
mhm,
And we call it intuition. We say, what does your heart think? What does your gut
mhm,
think? We
mhm,
say,
mhm,
sleep on it. People can use a pendulum to get the same answer because the
mhm,
pendulum is just an amplifier of
mhm,
what your body is already saying. And your body, loosely speaking, has an opinion on everything.
mhm, mhm,
Whether eating this organic apple is good for you or
mhm,
this artificial sweetener, it's going to have
mhm,
an opinion on that.
mhm, mhm,
And you can use this the way I
mhm,
do with my clients to pinpoint the
mhm.
trauma that is related to your migraine headaches, that
Yeah.
is related to the reason your back keeps going out,
Yeah.
and a host of other things in your life. And I
Mhm,
think that's important for people to at least understand that
mhm,
you have access to this deeper inner wisdom to
mhm.
help guide you through your life. You don't
You
have to
do.
use it to, ratify every decision you make, but it's
Mm-mm.
another insight
Mhm.
into what's going on here.
Yeah. No, it's so powerful. We love pendulums and all of the even using body sway. Some people
Yeah, yeah,
can,
sure. I do that
just
too.
that's what I felt I lost. I had no sway anymore. My body didn't have an opinion. It was so weird. And I
Wow.
used to have this strong sway and I could do my testing on my finger or just like press against and it was gone. So that's what I mean. That's what's coming back. But it is just wild and crazy. The body, the connection, the whatever this is that we're living through. So everything overreaching is we think that your body can heal and that you have all the answers.
Yeah, I
And
agree.
right? Anything else that we
No, just
missed?
blueskyhypnosis.com if they wanna find me, and my YouTube channel is Blue Sky Hypnosis.
Yeah, well, I mean, I think I would like to have a meeting with you so then we can do that too because
Sure.
I know how powerful it can be. Thank you so much for your time for being here. This was a very enjoyable conversation. Great getting to know you. Thank you
Yeah.
so much.
I feel the same way. Thank you for the invitation. I loved spending this time talking with you.
It's amazing. Thank you.